So health equity, ensuring and having the conditions, the power, the resources to achieve optimal health. It's important for all of us. This is desire to have all of these conditions and to realize health in its fullest way. But the realities is that there are tremendous gaps. Not all communities across this country, across the globe, experience opportunities, conditions, power, and resources. And so, but in order to get to health equity, we have to first value all individuals and populations equally. And most of us would absolutely probably, I would hope, raise our hands and say, of course we do. Of course we value all people equally. But the reality is that if you look at our data, the data of the systems, the institutions you work in, it shows that we don't value all people equally, because if we did, we would have outcomes that would actually demonstrate that. And it's a hard kind of, sometimes hard to swallow that, because we do want to believe we value all people equally, but our systems and structures don't, which mean we as people who are creating them, putting them in place, helping them move forward, also have probably some biases and some things that are operating that are preventing us from allowing us to really fully realize what it means to value all people equally. Rectifying and recognizing our historical injustices. Bobby, mentioned a lot of who we are right now at the current and present time as AMA, but we have a clear past that hasn't always been on the right side, quite frankly, and has excluded physicians that were Black. And there's lots of history. Actually, our strategic plan goes through it. But we have to name that, and we have to recognize that that has actually caused harm to people. Whether we intended it or not, it's about the impact. I think a lot of us, again, have good intention, but what is the impact of the decisions that you're making as you develop and you design whatever it is that you're working on? And then providing resources according to need, and this is a really critical part of equity. We can talk about it, we can sit here and discuss it, important, but ultimately the actions of it mean that we need to redistribute resources, and resources typically in the context of power in the context of decision making, and finances as well.
So another observation, that those that are marginalized in receiving of care are also missing from the tables that create that innovation. So the Black, Latinx, Indigenous, people of color, the women's population comprise about 70% of our population and hold an estimated 80% of the purchasing power of our communities, but are underrepresented in health solution investment, development, and purchasing decisions. So they collectively manage 1.3% of the $6.9 trillion of assets in the investment in this industry. And they receive 10% or less of the funding for new ventures and hold fewer than 43% of the leadership positions. So this group that makes up the majority is in the minority when it comes to influencing this process. So the resulting market of healthcare products and services is failing to drive a meaningful improvement in healthcare outcomes for these populations. And when these health solutions inadvertently are inadequately informed, they can exacerbate the inequitable access and outputs of care by perpetuating poor quality of healthcare due to the bias that's inherent in their development.
Ready to tackle social justice and equity today? Dive into the full session to get started.